Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number one states, which of the following is the most appropriate first-line treatment for a 45-year-old female patient diagnosed with generalized anxiety disorder? Is it A, fluoxetine, B, diazepam, C, lorazepam, or D, sertraline? Take a moment to tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? But here in this scenario, the question is the stem is the question, right? So it states, which of the following is the most appropriate first line treatment for generalized anxiety disorder, right? So you know that we typically go SSRIs. SSRIs, and then when you're narrowing these down, because if you look at these, and I always say know your endings, know your medication classes, B and C are benzos, right? And I know oftentimes we like to use benzos in assistance for anxiety, but because of the more so like addictive component of it, your SSRIs are listed as based off of the guidelines. And I always like to go back and emphasize on that. As again, I know what we do in practice, but based off of the guidelines, for testing purposes, your SSRIs are your first line therapy, with sertraline D being the top of those that we utilize, okay? So the best answer here is D, sertraline. Question number two, which of the following is a common side effect for ACE inhibitors? Is it A, hyperkalemia, B, hypokalemia, C, tachycardia, or D, constipation? Take a moment and tell me what you got, you guys. All right, so which of the following is a common side effect of ACE inhibitors? And I throw this in here because I like y'all to think more than what we just see all the time. Um, because if you get farm questions on boards, yes, we know that ACE inhibitors, you may have like a cough or angioedema, but also be aware that hyperkalemia is a component that they may have because there is some retention of potassium with these ACE inhibitors, especially like your lisinopril. So you want to be sure that you are monitoring potassium levels for the patients who are on ACEs, okay? All right, and lastly, question number three. A 56-year-old female patient with a history of type 2 diabetes presents to the clinic for an annual checkup. She is on metformin and has been well controlled with an A1C of 6.8%. During the visit, you notice that her feet are cold, pale, and have absent pulses. She reports intermittent claudication when walking more than a block. What is the most likely diagnosis? Is it A, PAD, B, diabetic neuropathy, C, venous insufficiency, or D, DVT? Take a moment and tell me what you got. All right, and the stem of the question here states, what is the most likely diagnosis? So, I always tell you when the stem of the question is asking for a diagnosis, you need to run it back and look at your assessment findings, right? So, this patient is a 56-year-old female, came in for her annual follow-up, right? Her annual checkup. Has a history of diabetes, is maintained on metformin, well controlled, A1C is still within a good range, but her feet are cold, pale, and pulses are absent, and she also has intermittent claudication. This is classic for PAD, right? So let's think about it. Y'all know, and if you struggle with that, go check out my PAD and CBI um, video. I talk about this because I know that when we see scenario style questions, oftentimes PAD and CBI we start to mix up. But I tell y'all, and y'all know Brittany's brilliance and my craziness, I say think of, Usher's song where they say peace up, A-Town down, right? So peace sign up. I always tell y'all to think of that. It looks like the letter V, right? When you do a peace sign with the two fingers, it's like the letter V. So peace up. Venus brings blood up to the heart. A-Town down, the letter A is pointing down. So arteries pull blood down from the heart. So when there is artery disease, we're not getting adequate blood flow down to those lower extremities, right? So here, if you're not getting blood flow down to the lower extremities adequately, you're going to have cold feet. There's going to be pale because there's not good blood flow, right? You would have absent pulses because there's not good blood flow, right? They would have that claudication, meaning because they're having that the claudication, they're having that intermittent pain when they're walking, because as they're walking and trying to force the blood flow to be more consistent, it's already at a deficit. So they're starting to have that intermittent pain where the body and those arteries are struggling to do its normal job. Okay, so peripheral artery disease with venous insufficiency, as veins bring blood, because peace up, right, bring blood up to the heart. It's typically more of your pulling or poor healing in the lower extremities. You may see like your varicose veins. DVTs do fall into that category. So just pay attention and start to break it down. Work backwards if you struggle with those style questions. Okay. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The things that I do offer are my review book. You can get it in a paperback or ebook option. They're both linked in the bio of this channel. You can do the self-paced review. It's also linked in the bio of this channel. If you need to do any practice questions, all of my QBank options are listed in the bio of this channel. And if you're looking to book any of my one-on-one sessions, as always, I tell you guys to either call, text, or email, as I offer a variety of session types. So I like to speak with you to gauge what you truly need to make sure you're booking the appropriate session. All right. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.